Hypertension, also known as high blood pressure, is a long-term medical condition where the blood pressure in the arteries is chronically elevated. High blood pressure is very common, and affects between 16 and 37% of the population. In 2010, it was a factor in 9.4 million deaths globally. High blood pressure typically does not show any symptoms, but is a major risk factor for many life-threatening conditions, including coronary artery disease, stroke, heart failure, atrial fibrillation, peripheral vascular disease, vision loss, chronic kidney disease, and dementia. High blood pressure is classified as either primary or secondary hypertension. Primary high blood pressure is also known as essential hypertension. Roughly 90 to 95% of people with high blood pressure have the primary type. This is high blood pressure caused by nonspecific lifestyle and genetic factors. Lifestyle factors that increase the risk of primary hypertension include smoking, being overweight, too much salt in the diet, and excessive alcohol use. The remaining 5 to 10% of cases are secondary hypertension, where an identifiable cause can be found, such as the use of birth control pills, chronic kidney disease, narrowing of the arteries to the kidneys, or an endocrine disorder like hyperthyroidism. Blood pressure is expressed by two measurements: the systolic number, which is the maximum pressure, and the diastolic number, which is the minimum pressure. For instance, a blood pressure of 120/70 would be normal in most people when they are at rest. For most adults, when they are resting, a normal maximum, or systolic, blood pressure is between 100 and 130 mm of mercury, and the minimum, or diastolic, pressure is between 60 and 80 mm of mercury. A high blood pressure is present when the resting blood pressure is persistently at, or above, 130/80, or 140/90 mm of mercury. It is important to realize, children have much different numbers that depend on their age and size. Measuring the blood pressure outside of an office, over a 24-hour period, appears to be more accurate than office-based blood pressure measurement. Hypertension occurs in approximately 8 to 10% of pregnancies. This is called gestational hypertension. Two blood pressure measurements, 6 hours apart, of greater than 140/90 mm of mercury, are diagnostic of hypertension in pregnancy, and should be immediately addressed. Research is clear that the treatment of moderately high blood pressure, defined as more than 160/100 mm of mercury, is associated with an improved life expectancy. The research is less clear on the effect of treatment of blood pressure between the ranges of 130 and 160 mm of mercury systolic, and 80 to 100 mm of mercury diastolic. Some reviews find benefit, and others do not. Lifestyle changes and medications can lower blood pressure and decrease the risk of health complications. Lifestyle changes include weight loss, physical exercise, decreased salt intake, reducing alcohol intake, and a healthy diet. If lifestyle changes are not sufficient, then blood pressure medications are used. Up to 3 different medications can control hypertension in 90% of people.